Hello, and in today's class we're going to continue our look at the musculoskeletal system. Over the last few weeks we've been looking at how we can use our yoga practice to maintain bone density, to maintain and improve joint range of movement. And we've also looked at common muscular imbalances around the hips, lower back, around the neck, upper back, shoulders, and also with the feet and knees. So those imbalances tend to pull joints out of their ideal alignment, and over time when they're held in that out of alignment, then there's various different pressures on the joints that can be lead to degeneration. And the area we're going to look at today is the thoracic spine. So the thoracic spine is part of your spine located between the neck and the lower back. So in the neck you have your cervical spine, 7 vertebrae. In the lower back you have 5 vertebrae, and between that you have your thoracic spine, which is really kind of roughly this area, and it's about 12 vertebrae there, and your rib cage is attached to that. So we're going to look at mobilizing this area because it's a very common area for stiffness. When that area is stiff, maybe it doesn't extend very well, maybe it doesn't rotate very well, but when that area is stiff, then the other areas above it and below it tend to compensate for that and perhaps overwork. So it can be a common cause of neck pain or back pain, and we're going to learn how to bring awareness to this area and deal with it and get movement. So today you'll probably want a blanket, folded blanket. You might need a bit of extra cushioning underneath you. So it's a floor-based practice, and we're going to start lying on the floor. So when you lie down, you can either have the legs straight, you might want the head on your blanket, or perhaps on the floor. That depends how your neck feels. So let's just check in with that. So if you lie down and you feel that your head is kind of tipped back and the back of the neck is short, then perhaps raising it up on a folded blanket or maybe even a yoga block can be useful. You could either keep the knees bent or even straighten out the legs, and then whichever is more comfortable for you, and then just allow the eyes to close. And let's start with a deep breath in. And as you exhale, you're just allowing your whole body weight to release down onto the floor. And just starting to bring the attention present by noticing where your head meets the floor. Notice whether the weight of the head falls central through the back of the head, or does it tip more to the left or right? Or maybe there's more weight to the upper back of the head. And you can even let the head turn from left to right a little bit. Just see how much rotation you have there in the neck, how the neck feels. How free does that movement feel? Come back to center. And then from there, let's take the awareness into the base of the skull. And take the attention down your neck, so the cervical vertebrae, 7 vertebrae there. That in this position will be curved away from the floor. You can just notice how deep that curve is. And then start to take the awareness a bit further down the spine until you feel the point of contact with your spine and the floor. And that'll be your thoracic spine. And it might be that you don't feel much contact, you'll feel some, or maybe there's quite a lot of contact. Just notice how much contact is there of your thoracic spine and the floor. So you can take the awareness, keep going down, and then notice the point where the spine comes away from the floor. And that's going into the lower back, the lumbar spine, the 5 vertebrae there. And then keep going down into the back of the pelvis now, so the sacrum. 5 vertebrae there that fuse together to make the sacrum bone. This is part of your spine, but it also slots into the pelvic bones, so it's part of the pelvis. And you might feel that on the floor. Maybe there's more weight to one side or the other. And then taking the attention a bit further down now into the tailbone. Mostly the tailbone might feel like it's slightly lifted off the floor, or maybe it feels flat to the floor. That might happen especially if you have a bit of an excessive lordosis or arch in the lower back. Begin to notice your shoulders and arms. Notice the buttocks and the legs. And pay attention to the breath. The breath flowing in and out through the nose. Keeping the breath relaxed. And when you're ready, we're going to start with the little pelvic movement. So we're going to bring the feet up to the floor. 1 and 2. The knees are bent. And we're going to do our arch and flatten movement here, just to get some release of the lower back and the abdomen. So just slowly, when you're ready, sensing the pelvis on the floor, you're going to tip your pelvis forward towards your feet. Letting the lower back muscles contract to arch the back. Notice how the chin might draw in toward the chest a little bit, and then you let that release. And you're going to flatten the lower back to the floor, letting the head tip back somewhat. And then arching again, feel that contraction through the back. Slowly release those back muscles and then flatten the back to the floor. Arching and flattening. So often the center of the body can be held quite tight also, as well as the thoracic spine. And if the center is tight, then the movement, when we walk, when we run, when we dance, when we reach around the room for things, the movement doesn't travel through the body, it kind of gets stuck. So when the center can move, then the whole body moves together, synergistically. Notice the rolling movement in the head. Come back to center. So let's add a little bit of rolling of the arms to get the chest muscles releasing and the shoulders releasing. So as you arch the back, let both arms roll out, so you'll feel the back of the shoulders press into the floor. And as you begin to flatten the back, let both arms roll in. The head will tip back, feel the chest muscles contracting, and let them slowly release, and then roll the arms out, arch. And then flatten the back, roll the arms inwards. One more. Come back to neutral. So this is called the flower. It's a somatic movement to free up tension in the abdomen, chest, actually the front and back of the body here. So let's add in the legs as well. So it also works with the legs a little bit, the inner thigh muscles. So as you arch the back, knees wide, arms roll out. And as you flatten the back, knees come together, arms roll in. And you repeat. Arch the back, roll the arms out, knees wide. And flatten the back, roll the arms in, and knees come together. Try that a couple of times. So here we're pandiculating the shoulders, the chest muscles. So it's like we're squeezing out tension. There's a squeeze and a slow release on each side of the body there, of the trunk. And if the chest muscles in particular are very tight, then it draws the shoulders forward. We looked at this a couple of weeks ago in this series of classes. And that can bring on that excessive hyperkyphosis. So kyphosis of the upper back is the rounded upper back. And the normal term for it is kyphosis, but when it gets excessively rounded, then it's hyperkyphosis. So let's just take a pause, come back to center, see how that feels for a moment. So now let's try a swiveling movement of the pelvis. So if you imagine your center of the sacrum, from the front, it's kind of bolted into the floor. So you can't turn left or right or forward and back, but all you can do is swivel around that central point. You can see if you can draw the right hip towards right armpit and back, and then left hip towards left armpit and back, and you're just alternating like that. So trying to notice here whether the pelvis tends to tip to the side as you do that, and if it does, can you keep it central? So you're sensing where the back of the pelvis meets the floor, and you're just keeping it central. Now with that, if you turn the palms down, we can add in our arm movement. Palms down and arms down by the side. So let's get some more movement into the shoulders. So as you draw the right hip towards the right armpit, slide the right hand down the mat. The head will turn to the right, left shoulder slides up the mat. You come back, and then as you slide left hip towards left armpit, right shoulder slides up the mat, and your head will turn to the left. And just repeat a few times. So we're working with the some spinal movements here, pelvic movements, shoulders as well getting involved. Notice what your breath wants to do. Okay, and we'll try one more time each side. And then we're coming back to center. Let's see how that feels. Okay, and then just a little bit of pelvic rotation here. So slight rotation, and we're just going to let the pelvis tip to the right and the left, right and left. So without moving the legs so much. So we're not tipping the knees from side to side yet. We're just letting the pelvis roll. You might notice that your legs get involved though. So as one foot pushes into the floor, that hip lifts, the pelvis rolls the other in the opposite direction, and you're just alternating like that. It's like the knee is moving forward towards the end of the mat. So we get this nice kind of rolling movement. Okay, and then come back to center, and then see if you can roll around the sacrum. So it's like a circular movement at the sacrum. So you can start by arching, tip the pelvis to the right, come back to center, flatten the back, tip the pelvis to the left, back to center, arching. So it's like you're rolling around the sacrum there. So you're trying to begin to free up the center. And then reverse the movement. See how that feels. All right, and then come back to center. Right, you might like to just straighten out the legs for a moment. Let's see how all that feels around the center of the body. Okay, so we're going to work a little bit more with the muscles at the side of the waist, and let's just take the feet up. So bring the feet to the floor, and you're going to roll onto your left side. So you're going to roll onto the left, and when you do that now, you might find you need a bit of extra padding underneath you. So when you lie on the side for your kind of hip bone, or the greater trochanter, or the side of the pelvis feels like it's digging into the floor, and add a blanket or something underneath you, some cushioning perhaps. So for this one, you can fold your blanket so that your head rests on the blanket like this, and then so we want to get this right. We want to try and bring the knees up level with the hips, and we're then taking the feet out so that the shins are roughly level with the side of your mat. So it wants to feel like your chest parallel to the side of the mat and the shins roughly parallel to the side of the mat. And we're going to just start with the hands stuck together. And if you can become aware of your pelvis and the top hip, and we're going to see, making sure the knees are kind of fairly high, so we've got like a right angle at the knees. Going to see if you can just slide the top hip forward and back, forward and back. See how much movement you got. And then come back to center. So now you just might notice, okay, we've got a bit of movement, and then slide the top hand forward and back and forward and back. Okay, and then come back to center. Now from there, if you bring the top hand into the side of the waist, we're going to go into the side bending. So the muscles that are involved in side bending are also involved in rotation. So when we free up those muscles through a little bit of pandiculating movement, so contracting, slowly releasing, we might find we get a little bit more rotation. So we're going to keep the feet together, take the top hand into the side of the waist, and you can imagine as though your back is lying flat against the wall. Just going to let both feet lift up toward the ceiling, keeping the feet and knees together. Notice that hip drawing up toward the armpit, the waist muscles contract, and then you allow that to slowly release. Slowly release it. So your feet lift, feel the side of the waist contracting, and then slow release. Try that again. Lift the feet. Notice whether the hip rolls forward, or can you keep it drawing up toward the armpit. If your hip does roll forward, it might mean that you don't have the knees high up enough. Okay, so then let's raise the head. So you can keep the hand on the waist, just looking out to the side. We're going to let the head lift a little bit. It doesn't have to lift so high. You can feel that contraction through the side of the waist, and then let it release. If there's any problem in the neck there and you feel you need support for the head, you can take the top hand over the top of the head to the underneath ear, and as you lift the head, your hand is supporting the head, but the action is coming from the muscles at the side of the trunk there. So you lift it, feel that contraction. You can lift higher if that feels okay. Nice contraction through the side abdominals, and then slowly release it. Okay, relax the arm for a moment. And we're going to try the two together. So you can either have the hand over the top of the head, or maybe hand on the waist if that helps, or arm just relaxing down by the side. And when you're ready, we're going to breathe in. Feel the top ribs expand. As you breathe out, lift the feet, lift the head. Feel that contraction. And let it slowly release. And then as you exhale, lift. Try and make sure the pelvis isn't rolling forward or back. And then lift and release and lift and release, and then relax for a moment. Okay, so that's predominantly working with the muscles at the side of the waist. We're going to work a little bit more onto the side of the lower back by sliding the knees down a little bit and bringing the feet a bit closer into the center of the mat. The knees are still roughly at 90 degrees, but now the hip angle has opened up a little bit more. And with this one, you can bring the fingers, if you can reach it, to touch or feel around the right side of the lower back. You have some muscles here called quadratus lumborum. Sometimes they get tight and affect the tilting. They might tip the pelvis a little bit to one side. So one way to nicely deal with that is just to, from this position with the knees coming a bit further away from the trunk, we're going to lift both feet up again. But now the hip tips forward. And if you can feel that in the lower back, it will contract and lengthen, nicely lengthening out that muscle. So you lift the feet, the muscle's shortening. It's called concentric contraction. And then the brain's learning to lengthen that muscle under a load. So it's got the weight there of the legs. And then when the legs come down, you should feel that muscle softening there. Try it again. So there'll be a combination of muscles going on here, a little bit round the side, lower back on the side as well. And one more time. Okay, so let's go on to the back and just see how that feels. So when you lie on the back, maybe even straightening out the legs, notice the two sides of the body. Notice any difference. And then you can bring the feet to the floor, and with the feet fairly close together, knees close together, let your knees lower to the left, arms a little bit wider. Do it slowly so the one foot stacks on top of the other. Notice how far you go and how easy or loose or maybe tight it feels. And you can come back and you can just try that again just to see how that feels. Right, and then come back and then try it the other way. And notice, does it feel the same or does it feel a bit tighter? Maybe the knees don't go as far because we haven't pandiculated that area yet. Alright, so what you might find there is that the knees go further to the left than the right because we've worked with releasing through the whole right side of the body. So let's turn to the other side, or if you're watching the video, if you need to watch, you can just spin yourself around, which I'm going to do, so I'm facing forward. And again, you can just see, take the arms out and you can let that knees up, feet come out as well. Just let that top knee slide forward and back a little bit. Might already feel easier. And then top hand slides forward and back a bit. Okay, so then let's take the top hand into the side of the waist. And we're going to bring the feet up away from the floor. Feel that contraction. And then allow it to slowly release until it completely relaxes. And then you lift and you lower. And you lift. And the hip trying to draw up toward the armpit, not forward for this one. And lower. Okay, so let's just bring in some head movement. So when you're ready, we're going to lift the head now. So you can either have the hand on the waist and just lift the head a little bit, or use the top hand over the top of the head. And it always depends on how the neck feels. So when you're ready, just lifting the head, but trying to feel how it's like that lift comes from the side of the waist, and then slow release. Yeah. You can try it again. Any neck issues, then use your hand or make sure that your side of the waist, oblique muscles are doing the work. And then relax. So let's join those in together. We're going to lift the feet and the head. When you're ready, you can inhale. As you exhale, feet lift, head lifts, armpit and hip moving towards each other. Nice, slow release. We're learning to lengthen and release the muscles from the level of the nervous system, so without pulling, without stretching. Contracting, slowly releasing. You can try it again. Okay, and then bring the head down. Now let's take the knees a little bit further down away from us, so the feet come more toward the center of the mat. And then this time feeling the side of the lower back, the side of the lumbar area, the top side, so that's the left side. And as you now raise both feet up, the hip will drop forward and inwards, and you might feel that a little bit more in the back muscles on the left. Coming back. Contract. Slow release. Remember to slowly release it. Keep breathing. Notice any shakiness in the movement. All right, let's roll onto the back and we'll see how this feels. So these floor-based movements can be nice to work with because we don't have the balance to deal with, you know, when you're standing. Although that is a good thing to work with balance, of course, but also you don't have the compression on the spine from gravity. So that can be nice to work with the rotations. But also, obviously, it's good to work in those standing positions as well. But today the focus is more on the floor practice. So now if you bring the feet and knees together, you can take the knees over to your left. So that was the first time we went over, see how far they go. And then bring the knees back up. You'll feel a contraction there, the side of the waist. And then go to the right and feel, does the left side feel a little bit more released now? And back up. Try it one more time each side. Ideally, we should feel a little bit more balanced in that rotation. Okay, and then you might want to just straighten out the legs for a moment and just see how that feels. Okay, so we're going to work a little bit more on the side with rotation now. So again, roll onto your left side. I'll spin around once again. So roll onto the left side. Use your blanket. And with this one, it's like we did beginning, we were just kind of testing it. This time we're going to go back to this sideline position with the knees up 90 degrees at the knees and the hips, and then the hands out in front. So see if you can focus on keeping the hands still, stuck together, and let the top knee or hip slide forward and back, forward and back. So we're focusing on that rotation from the pelvis upwards. Now most of that rotation will be coming from the thoracic spine. You're trying to keep your chest fairly still, So if you can feel on the underneath side, and it's pretty difficult to do that, so you feel your chest on the underneath side against the floor, and if your chest rolls forward, you'll feel it on the underneath side. So can you try and avoid that? Keep, just for the moment, keeping the chest fairly still, taking the knee forward and back, and then you might find actually, oh yeah, it's a smaller movement if we try and keep the chest still. So that the movement in the lumbar area is a really small amount, 5 degrees. Thoracic spine should have about 35 degrees. So we're moving more than 5 degrees there. So there's some coming into that thoracic spine. So now keep the knees together. Keep the top arm straight, and let's allow the top hand to slide forward and back. So notice you'll get the rolling in the chest, but the pelvis wants to stay still. And forward and back. Notice how the head will turn with that. Okay, and then come back to center. All right, so now let's see if we can take the hand and the hip and knee forward and back. So when you're ready, hand slides forward, hip, knee draws forward. You'll go a lot further, the head will turn in toward the floor. And then as you slide the hand back, let the knee and hip slide back. And the elbow will bend a little bit, because you'll be going a lot further now. So sliding forward, and the hip comes forward, and then as you slide back, you can slide the hand up toward the chest, letting the head turn with that. Forward, and then back. And if you want to reach the arm behind you, you might need to let your top knee lift so that you can comfortably turn everything all the way to the right. So notice the head, chest, pelvis is all turning to the right. Of course, one a little bit more, so head more than chest, chest more than pelvis, and then you come back. So letting everything turn together here. So the more you some of you lift that knee as it draw back and lift, the more you'll find that the shoulder will come to the floor. And then coming back. So there we had like a turning movement. The head, pelvis and the chest and pelvis all turning. So now let's try the twisting movement. This might feel a little bit more challenging, so let's see how we go. So now you're going to let the hand slide forward as your knee slides back. So you're not going to go as far. Hand and shoulder slide back as the knee and hip slide forward. Hand, shoulder forward, knee, hip back. Hand, shoulder back, knee, hip forward. Can you get that? So try that now a few times. Notice now we're actually making a twisting movement where the two ends, so the chest and the pelvis, are going in opposite directions. And then come back to center. Great, so let's roll onto the back. Let's test out our rotation. And the reason we keep for this testing the rotations, because we're noticing the rotation of the spine. The reason we keep the knees and feet together is because when you do that, the hips don't rotate. The hips are kind of staying fairly steady. If you took the feet wider, then a lot of that movement comes into the hip joints, less movement in the spine, which is nice. It can be fine to do that. You can explore the variations, but just for the purposes of experimenting and noticing, now let's take the knees over to the left. See how far you go. And feel that on the underneath side of the pelvis, and then back up. Take the knees over to the right. Which way do you move more? So you might find the knees go a little bit further to the left at the moment. Okay, great. Just straighten out the legs for a moment, see how that feels. All right, so let's try that sequence on the other side. So when you're ready, just turning round, turning onto the other side. We're going to take the arms out in front of us again, knees up, feet coming out, and we'll let the hands stay together as the top knee moves forward and back, or the hip. So it's like the thighs are rubbing against each other. Okay, now keep the legs steady and take the top hand forward and back. And for this one, just because we're keeping the pelvis and the knees fairly still, you can just allow the top arm to be straight. You really focus on that movement of the chest, rib cage. Okay, and come back. And then let's slide knee and hand forward and back. So knee and hand slide forward. Notice you'll go further. And then as you slide back, the hand will start to slide toward the chest. We're going a lot further this time. And even if you wanted to reach the arm out behind you, you might let the top knee lift so that the shoulder, back of the shoulder comfortably reaches the floor. So you can't force the shoulder to the floor, you can only lengthen through the waist, let that top knee lift to allow the pelvis to turn. Okay, and then coming back. Good, and then we can try the twisting moves. That's turning, everything turning, now more twisting. So the twisting is like you take a wet tea towel or something and you squeeze it and the two ends are moving in the opposite direction. The turning, everything was going. So it's still a rotation, but everything was going the same way. So now this way we'll feel a little bit more limited in the movement. So as the hip and knee go forward, hand and shoulder slide back. And as the hand and shoulder slide forward, hip and knee slide back. Hip and knee forward, hand, shoulder back. Hip, knee back, hand, shoulder forward. You just alternate. Okay, and this can be a little bit tricky, that, can't it? It can be quite tricky. So have a little play around with that. Good, when you're done, roll onto the back once again. And let's test out our rotation. So often when we do, some of the yoga poses and we turn and raise the arm or whatever, we're in a triangle pose or something, often the neck does all the movement, or we just pull the arm back and the chest doesn't move. So we're trying to really get that rotation into that thoracic area. If you bring the feet and knees together, take the arms away from the body, and we'll lower the knees to the left. So that's the first side we worked on. Knees might go a bit further. And we come back and lower the knees to the right. And maybe we feel a little bit more balanced out there in our rotations. Okay, and then come back, take a pause, slide the legs out. See how that feels. Okay, so whilst you're lying here, again, notice how much of your thoracic spine is meeting the floor again. Does it feel different? Is there more of the thoracic spine meeting the floor? Maybe you feel there's a little bit more of that part meeting the floor now. So if you can just roll over onto the front of the body now. So we're going to look at a little bit of extension through thoracic spine. So in the back bending movements, so when we do kind of things like cobra or just raising the head from the floor, if we're not aware of that thoracic area very well, or if it's very stiff, a lot of the movement just comes into the neck. So just notice that when you lift the head and look forward, how much of your spine feels like it's getting involved. So how far can you feel that down the back? Is it just the neck? So that means you might just be looking forward without lifting the chest, or can you feel as though you're trying to lift the chest as the head lifts, and then maybe take the gaze forward and then come back. So usually the eyes are leading the movement, but sometimes when the eyes lead the movement, all the movement's in the neck. So you could start looking down at the floor, lifting the chest first, and then look forward. And you might find we get a much better lift. Okay, great. And then if the abdomen's very tight, so we've dealt a little bit with that, then we might find that the rib cage doesn't lift much. So what you could do is press your pubic bone into the floor. Feel that squeeze at the front of the abdomen, contracting, pulling the lower ribs down. Now release the belly, like feel as though you're lengthening from the pubic bone, creating as much space between the pubic bone and the lower ribs, and then lifting and looking forward. You might find you go even a little bit higher there. So you can press the pubic bone into the floor, feel the contraction through the abdomen, and then lift the ribs, feel the ribs sliding forward, creating that space, and taking the gaze forward. And without feeling any compression in the lower back. Let's try that one more time. Press the pubic bone, you might even press the head a little bit, and then releasing through the front. Okay, and then go to lying on your back. Let's see if that feels any different now as we lie on the floor. So just noticing, just taking your time to notice what you feel. All right. So you might sense a little bit more of that thoracic spine on the floor. Okay, so one thing from seated, we're going to bring the feet to the floor. We're going to roll to one side, and you're going to push yourself up. Now in this position, you can either be cross-legged, if that's comfortable for you, and you might use a block to sit on, or you might be able to kneel and sit back on the heels. And if that's not comfortable, then again you can take a couple of blocks and place it between the ankles so you can sit on that. So you're just going to take your gaze around to your right. So you're looking round, seeing how far you go, and then come back to center. So take the gaze to the left. See how far you go. Come back to center. Now, when we look around, we're usually using our eyes to lead the movement. That's the natural way we do it. But sometimes, if there's lack of awareness at thoracic area, all the movement's just in the neck. So one way to just kind of work with that a little bit is to start the turn from the lower spine upwards. So this time, keeping the chin in line with the center of the chest, turn your belly to the right. So there won't be a great deal of movement. Once that's stuck, turn the chest as far as you can, turn the chest, then the neck, head, and eyes. Have you gone any further? And release back to center. To the left, turn the belly, chest. As the chest turns, then the neck, head, eyes. You might notice that when you go like that, you're going a little bit further because you're focusing on actually turning the chest. Try it one more time. Belly to the right, belly, chest, neck, head, eyes, and back. To the left, belly, chest, belly, chest, neck, head, eyes, and then back. Okay, so that might bring a little bit more awareness to the thoracic area. So let's go back to leading with the eyes, because really that's what we want. We want to lead with the eyes, but we want that to see if we can get the rest of the spine involved. So you're turning to the right, eyes, head, neck, chest. So now we might find, oh yeah, I can get a little bit more turn because now I'm aware of the area turning. And to the left, eyes, neck, chest, belly. We come back one more time each side. Okay, and then we're going to come back onto the floor now just to finish off. So if you bring your feet up, and might be nice just to finish there with a little movement that we did in the beginning, the arch and flatten movement. So you can just gently arch the back and release it, and then flatten the back and arch and flatten, arching and flattening. And then you could test again your rotation, feet and knees together, to knees to the left. You've gone any further, back up, and then knees to the right, and back up. Okay, so then from there, slide the legs out. Let's have a bit of a scan and notice what we feel. So sensing once again into the back of the head. Sense where the back of the head meets the floor. Sensing into the neck. You might even actually let the head roll from side to side, see if there's more movement there, or less stiffness or tightness. Back to center. Check into the back of the neck, and then so cervical spine. Notice the curve there. Is it any different? Now notice where your spine meets the floor. Does it feel a little bit higher up than before? how much of your spine is meeting the floor. And then notice the curve where the spine starts to leave the floor in the lower back. And then it meets it again at the sacrum. And then the tailbone. And notice both arms on the floor, both shoulders, the hands and fingers. Notice the buttocks, the legs, feet, toes. Begin to observe the breath. The whole body softening with each out breath. And when you feel ready, bring some movement back. You might like to just bring yourself upright, or maybe you want to stay there a little bit longer. So there's a floor-based practice to work with mobilizing the thoracic spine. I hope you enjoyed it. We will have another standing practice in a different video to work a little bit more with that area and focusing on whole body movements. Thanks for watching.